I'm a Paxlovid fan, but we really only know what we're doing with it essentially above the age of 75. Anybody else, we don't really know what we're doing with it. However, back to our original conversation about improvising, I have used it in young people to great success because it works, man. Paxlovid works. But I will tell you, I've seen a number of cases of rebound. Rebound is a real thing. It happens not that infrequently, but I'm a fan of the medicine because I know I can rely on it. I have a lingering concern. I will tell you what, my daughter had Omicron. Her doctor gave her Paxlovid. I thought, a little young to be getting that, but okay. And 1 month later, or was it 2 months later, Susan, got Omicron again. So I'm wondering if the Paxlovid impairs the immune response to the virus such that you're prone to reinfection, which is kind of interesting, right? That's not been talked about anywhere. But this is what we would find out if we did the proper studies. But of course, we're not doing that. Of course, and molnupiravir. Go ahead.
Well, just had a chance to talk about it. So, Paxlovid is nirmatrelvir, which is a novel kinase-like 3 inhibitor, plus ritonavir, an older HIV protease inhibitor. In the EPIC-HR study, it was actually tested in people age 45 and unvaccinated. So we had little data actually in the elderly, and we had no data in the fully vaccinated. And the CDC, because of these cases of rebound, which were serious, they put out a health advisory on Paxlovid, essentially saying don't use it in the vaccinated because we'll have rebound. The reason why we have been very open and integrative with the use of hydroxychloroquine and ivermectin is because they had established safety profiles, and there's never been cases of rebound described with hydroxy or ivermectin-based approaches. So they became the community standard of care. Hydroxy or ivermectin are the base drug in about 24 government protocols and about 50 or so non-government organized protocols worldwide. So Paxlovid is kind of the new drug on the block, and I've used it as well. But I use it according to what was done in the clinical trials, and in someone fully vaccinated, I wouldn't go against the CDC advisory.
It's interesting because Bourla, the CEO of Pfizer, who is reportedly 4 times vaccinated, meaning he received the first 2 shots of his own vaccine and then got 2 boosters, now is sick with COVID and is taking Paxlovid or Paxlovid, as you call it, which I prefer. He's taking Paxlovid, which would lead one to believe that he doesn't have a tremendous amount of faith in his 4 shots of his own vaccine, because Paxlovid is supposed to be given to people who you think may have a rough go of it and are at particularly high risk. It's not intended to be given to people with mild cases. I think to Drew's point, I think the better evidence with regard to immune suppression is really about the immune suppression from the vaccines themselves. Whether or not Paxlovid actually does that or not, I can't say. There's clearly evidence and mounting evidence that the vaccines themselves suppress the normal immune response. Do you agree with that?
Yeah, there's more and more papers coming in. Just to finish with Paxlovid, though, is that the cases of rebound, which some of them come out of the Boston VA and the Harvard system, they clearly were infectious with 2 big and personal infectious curves. So somehow the medicine alone, reduces viral replication, but doesn't allow the body, in a sense, to finish off the virus. And that's the reason why, when I devised the first paper on how to treat COVID-19, I said, no way are we going to use a single drug. We don't do that even for a staph infection. There's no way we're going to use a single drug for a fatal infection. So it's always drugs in combination. Interestingly, I checked American Journal of Medicine just recently. My paper is still the most widely read paper in that journal now for over 2 years. If that gives you any proxy of how interested people are in treating COVID, because it's such a big problem. So we use drugs in combination, and we saw the mistake it was made with Fauci, it was made with President Biden, and now Bourla. So here they are, off the inclusion-exclusion criteria. They're not following a community standard of care. They, in a sense, and they become poster childs for, if you take 4 vaccinations and still have a breakthrough, the only consolation prize is maybe having a milder syndrome, but Omicron is mild as it is. So, and that claim, again, this idea of it makes it milder, that claim is not substantiated.